Jessica, you say that PTSD is very real and you're glad to be talking about it, right?
Absolutely. I think it's going to impact a number of us. As it already has, but I think it's going to really leave a lasting impact.
Well, as you know, I've been talking about this quite a bit, but people don't seem to want to talk about this. Why do you think that is?
It may make people feel more vulnerable to talk about it or talk about their feelings or how it's truly affecting them.
Do you think that if people do acknowledge this, it's kind of like the monster's going to catch up? Because I'm just wondering here. I look at some of the situations you've been through, and you recounted one. We know that a lot of elderly patients pass away, but you had a real hands-on struggle with a 47-year-old in ICU with a lot of your colleagues looking on during that struggle. Tell me what happened.
That's correct. So this particular patient is only a few years older than myself. She was a rapid response. She was completely lucid. She knew what was going on when we came in. She was very short of breath. She was in a ton of distress, positive for COVID-19. The physicians elected to put her on a ventilator. So we transferred her to the ICU. I talked her through everything that was going to happen. She trusted us, which is what bothers us the most as healthcare workers. We're doing everything we can and we're doing it in the best way that we can, yet we're not getting the outcomes that we're looking for. So this particular woman's heart stopped about a week later after all the different treatment modalities that we felt were appropriate. And she coded and she was in one of our ICU rooms with the glass doors, and we all were looking in because we're minimizing staff during emergencies. So there was only about 5 of us in there and the rest were looking on in order to help if something was needed.
Right.
And despite our efforts, she didn't make it. And everyone that was in the room kind of just turned around. The silence was so thick. No one spoke. Everyone was very somber. And everybody just turned around and looked at us like, we tried.
After these patients do die, what is your role in dealing with the body itself?
As a nurse,
Yes, I mean,
we
at this
actually
point,
have
you
to,
actually have to prepare the body to go to the morgue, right?
yes, we do. Down to the toe tags and all, like you see in the movies.
Yeah. There's just kind of nowhere to run and nowhere to hide from the stress and pressure of this.
I actually helped to prepare or to do the postmortem care on this patient because I felt mentally that it would help me to follow it through. And we did make an exception for her family to come in, and I was the one that went to the lobby to get them.
You say that the staff on ICU calls you Dr. Phil. Why is that?
It's funny, because I'm the town therapist, because I hold everybody's problems on my shoulders, and it's become a joke over many years. Hey, Dr. Phil. Hey, Dr. Phil.
You're doing my work for me there in the hospital. I appreciate that. Listen, this is something where you guys are really leaning on each other in many respects because you really don't have anywhere else to turn, right?
We are absolutely more than coworkers. We are family. We love each other. We lean on each other, and the community has been very supportive.
Well, I know even now you say that sometimes in the morning you just don't want to wake up because the anxiety you know you're going to have to face, the issues you're going to have to deal with. But this too, we know that eventually this is going to cycle down, I mean, at least temporarily. What do you think you and others are going to need once the most critical crisis is over?
We're going to need each other. We're going to continue to need each other. We're going to probably need to have big gatherings where we celebrate that we all made it through. We're going to need to continue to speak to each other and counsel one another. This is something unprecedented that we've never had to deal with before.